So homeostasis. So the definition of homeostasis is the maintenance of a constant internal environment. And how we maintain that, there's internal sensors or receptors that monitor some of these different things like blood pressure, blood glucose, your blood gases and pH, osmolarity, which is all special receptors, right? Chemoreceptors measuring the hydrogen ion content and blood gases like CO2 and O2. We have baroreceptors measuring your blood pressure. There's osmoreceptors measuring blood osmolarity. The beta cells in your pancreas are measuring your blood glucose, basically like a continuous blood glucose monitor. So we have these internal things. So we do these external tests like a blood pressure cuff to check your blood pressure, or using an arterial line, which is a little more invasive, or finger sticks for blood glucose, or blood draws for glucose, or someone wearing a continuous, glucose monitor. Those are ways we have, monitored things externally. So our body has internal monitors. So what are some examples here? So the ranges for like blood pressure, blood glucose, we didn't make those up, right? We studied the body and realized, hey, if the fasting blood glucose is between 60 and 99 milligrams per deciliter, people do pretty good. If it starts creeping above that, well, those high levels of glucose can actually sometimes be toxic to blood vessels and cause all kinds of damage to your eyes and your kidneys and your larger blood vessels and cause neuropathy and all kinds of awful things that you see in diabetes, right? If blood glucose is too low, we see lots of bad things as well, because hypoglycemia can kill you acutely. People get confused. Their brain needs a large majority of what it runs on is glucose to make ATP. Get confused, get disoriented, and then next thing you know, someone is in a coma and they can actually die, right? So it's bad. So we have to maintain that, right? Or things like, your blood pH should be 7.35 to 7.45 in arterial blood. When things are in that range, things work really well. When they go too low, your patient's acidotic. Too high, your patient's alkalotic. Problems, right? There's problems. Things don't work as well as they should, okay? And you can use that example for a bunch of different things, right? So when your patients are coming in, right, we've determined these ranges. That's when the body tends to work the best. You get blood work, you get your vitals. We look at all these things. Just like when you get blood work, you see all your list of your values, and to the right, you see what a normal range is. And some labs can vary a little bit, whether it's an arterial blood gas or a metabolic panel or complete blood count, or whatever labs you're getting, and hemoglobin A1C, whatever. Okay, so when your patients come in, they're not going to be in homeostasis, most likely, right? And your goal is to take them from out of homeostasis back into homeostasis. So examples of out of homeostasis, well, the whole blood pressure thing, they can be hypotensive or hypertensive. So again, organs aren't getting perfused, they're not getting oxygen, bad. Or blood pressure is too high, that's causing turbulent blood flow. It's going to damage your blood vessels, cause a stroke, a heart attack, aortic dissection. So your job is to give them medicine and get them back from being hypotensive or hypertensive back into homeostasis, okay, or at least close as possible, right? So again, if someone's blood pressure was 180 over 110, and you just deemed they have a hypertensive urgency or emergency, now their blood pressure is 140 over 90. Well, is it still too high? Yeah, it's level 2 hypertension based on the AHA guidelines, but it's going to get them out of the hospital. They're not going to die today. Is that going to damage their kidneys and their heart over years and years' time? Well, sure, follow up with your doctor, get taken care of. So the setting you're in is going to be important as well, right? Same thing with hypo and hyperglycemia. We'll get them back to, normal blood glucose, right? Or euglycemia, I guess. So normal blood glucose. So if their blood glucose was 700, well, now it's back to 180, 190 fasting. Is that way too high? It's still too high, sure, but it's not going to make them sick and dehydrate and cause all kinds of electrolyte imbalances right now. They're good enough. You've rehydrated them, you've balanced their electrolytes, their glucose is lower. You can get them out of the hospital, the ER, or wherever, and have them follow up their doctor. And then obviously in an outpatient setting, you want to get that even closer to homeostasis. Things like acidosis and alkalosis, huge things here, right? We want to balance our acids and bases, right? So if someone comes in, they have an acidosis or an alkalosis, which are something you're going to have to learn. You usually look at from arterial blood gas. The pH is too low or too high, you have to balance that out. Usually do that by treating the underlying cause. Obviously, there's things you can give in the meantime to kind of help balance out the acids and bases, like sodium bicarb. But that's the goal, right? Get them back to at least close to a normal pH, right? Hypo or hyperkalemia, so all of your electrolytes, right? I use potassium as an example because it can be deadly, right? Normal potassium should be about 3.5 to 5 milliequivalents per liter. So if it's too low, it can cause arrhythmias, which you'll learn when you get talking about cardiac function. Hyperkalemia also can cause arrhythmias, can get real scary. If it starts getting up to 6, 6.5, gets real scary because patients can go and actually develop ventricular fibrillation and go into asystole, right? Their heart can stop. So we need normal potassium. So either we have to replenish the potassium if it's low, or if it's too high, there's ways to lower your potassium by like giving insulin and glucose and different tricks to lower it, right? And then hypoxemia and hypercapnia put this. So, if someone's not oxygenating well, right? So they're going to have low SpO2 or low SaO2 if you get arterial blood gas. Their oxygen levels are low. They're not oxygenating. Their CO2 is building up, which will cause an acidosis. So again, balancing out blood gases. Again, you're going to have to treat the underlying cause and get our patients back to having normal blood gases. Normal blood gases, right? Because we need to oxygenate our tissues because we're constantly making CO2 and we constantly need O2. So we need to make sure those are balanced. Okay, so the whole point of this is these values we've come up with, we studied the body and realized this is when the body works the best. That's homeostasis. We're maintaining that specific control environment. And when patients come in, they're not going to be in homeostasis, and we need to get them either back to completely or close enough to homeostasis, but also depends on your setting, right? Obviously, you want everyone who comes in with blood glucose of 700 to walk out, my fasting blood glucose is, 85. Probably not going to happen, right? Or someone's blood pressure is, again, 200 over 120. They're probably not going to walk out of the hospital with a 120 over 80 blood pressure, but you're going to keep them from dying, right? You're going to keep them from dying or have some really major event happen. That's your job. And then, obviously if they can follow up and hopefully continue doing the things they're supposed to do, follow up with their doctors and outpatient, and then, tweak that thing even better. So this is real life. I know sometimes you read about homeostasis and like what all these words and effector and all this stuff. And, this is it's really